Hi, I'm Junior Intern Jocelyn Gloria Baral, and before we start, I would just like to first show you my surrounding. So for this return demo, I'll be showing you how to perform essential intrapartum newborn care, a set of evidence-based practices recommended by the Department of Health and World Health Organization as a standard of care, which is given in all births attended by skilled health practitioners in all government and private settings. So first, we'll be preparing the materials that we'll be using, and we'll be arranging them in a linear fashion. So we'll be using 2 pairs of sterile gloves, clean linen bonnet, plastic clamp, instrument clamp, oxytocin injection, sterile scissors, 2 kidney basin, and an extra gauze. So this box here represents the mother's abdomen. This is the umbilicus. This is the symphysis pubis, and this opening here is the vulva. So of course, before starting any kind of procedure, we first should do proper surgical hand washing. And for the purpose of this video, we'll be doing double gloving. So assuming that our patient is already in the second stage of labor and is already crowning, it's first important to ensure that the temperature of the delivery area is between 25 to 28 degrees Celsius. So we'll first put the linen on the mother's abdomen and encourage her to push as she desires. No routine episiotomy and no fundal pressure. So once the baby's head is at the perineum and it's now able to distend the vaginal introitus at around 5 centimeters, we can do perineal support. And when once the head falls posteriorly and is now facing the maternal anus, we can use both of our hands to support the delivery of the anterior shoulder using downward traction, and the delivery of the posterior shoulder using upward traction. And almost always, the whole body of the baby will follow. We'll then put the baby on the mother's abdomen and do immediate and thorough drying, wiping the eyes, the head, the whole face, the front, the back, the arms, and the legs. And then we'll set aside the first linen. Simultaneously, we will call out the time of the birth and sex of the baby. So baby girl out 9 o'clock p.m. So when the baby is breathing normally or spontaneously, it's important that we do not do any manipulation such as routine suctioning, which may cause trauma or infection to the baby. So after immediate and thorough drying, we will put the baby prone on the mother's abdomen for early skin-to-skin contact. If the baby is delivered by a cesarean section, then we'll put her on the chest area. And then we will cover the baby's back with the second linen, its head with a bonnet, and we'll now observe the cord for the pulsations. And once the cord pulsations have stopped, which is typically around 1 to 3 minutes, we'll use the first clamp to set up and place it 2 centimeters. The instrument clamp 5 centimeters from the baby's abdomen. And then we will cut using sterile scissors near the plastic clamp. So once that is done, make sure that there is no second baby, and make sure to inject our 10 IU oxytocin intramuscularly. So it's also important that we do not do anything on the umbilical stump. We do not do any manipulation such as bandaging or binding. We just leave it as it is, uncovered, and if there are any traces of blood, we'll just wipe it with a sterile cotton or gauze. And after that, we will wait for strong uterine contractions and massage the uterus, see if it's contracting. And now we will apply cord traction and counter traction on the uterus. So once the placenta is delivered, we should check for its completeness. Placenta complete, 10:25 p.m. Now we will check for the perineal area, the lower vagina, and the vulva for any bleeding, laceration, or tears. And the last step for the EINC is, of course, the non-separation of the baby from the mother for the initiation of breastfeeding. That will be all po. Thank you.